So my name is Félice Lê-Scherban. I'm here with Rich Dollery, Christina Brown, Kelley Traister, Hyden Terrell, and Rita Nelson. We're joining you from Drexel University in Philadelphia. And to give you just a little overview of how this session is going to go, I'm going to start by giving a brief research presentation to provide some context on the salience of racial discrimination and the importance of advancing racial equity in social care research. Then Kelley will give an overview of the community engaged approach to research in the West Philly Promise Neighborhood Place-Based Initiative. And then Rich will moderate a panel discussion with Christina, Hyden, and Rita, who are researchers with the West Philly Promise neighborhood, as well as residents of the neighborhood, on their experiences and perspectives on the relationship between research institutions and communities. And we'll be asking you for your thoughts along the way. And we've also set aside some time at the end for open discussion and questions. So first, here are the common agreements that we have across the Siren Conference for a safe and brave meeting. I'm going to just quickly go through them. We will try to and ask you also to practice active, judgment-free, and empathetic listening, respect each other's differences and backgrounds, agree to disagree but seek understanding. We're all here to learn. Honor the difference between unsafe and uncomfortable. Be curious about intentions, but recognize that impact is more important than intentions. Welcome being called in as a gift and an invitation to learn. Be mindful of positionality and power dynamics. Acknowledge judgments and assumptions, including our own. We all have biases. Use inclusive language and avoid using derogatory or stigmatizing language. Release control, privilege, and notions of being right, and accept that things may remain unresolved. We might not feel a sense of closure. I also want to draw your attention to 3 ways to engage in the Zoom room. One is through the chat window. We welcome your thoughts and your questions in the chat, and we'll also be specifically asking you to share your thoughts in the chat along the way. You also have emoji reactions at the bottom of your screen, as well as audio and video. And please feel free to join us on Twitter as well. Okay. I'm going to jump into that first presentation. I'm going to be talking about the associations of lifetime experiences of racial or ethnic discrimination, which I'm going to shorten into EOD for experiences of discrimination, with household material hardships among mothers of young children. So material hardships at the household level, by this I mean things like food insecurity, housing instability, have known adverse child and family health impacts. And there's this new but growing evidence showing that experiences of discrimination are related to these material hardships. And in particular, that there might be family-wide effects, right? So if an individual experiences discrimination, and then that has effects on the entire family, not just on that individual. So our objective was to examine associations between lifetime EOD and odds of having a hardship-free household among mothers of young children. And to do this, we used survey data from Children's HealthWatch. We conducted surveys among mothers of children aged under 4 years in 4 US cities, that's Boston, Little Rock, Minneapolis, and Philadelphia, when they were presenting for care at emergency departments or pediatric primary care clinics in hospital settings. So mothers answered questions on their experiences of discrimination throughout their lifetimes. To do this, we used a questionnaire validated by Nancy Krieger and colleagues, where mothers were asked to report on the frequency with which they experienced racial or ethnic discrimination in 11 different settings. So for example, in work settings, in stores and public settings, or in education settings. And then we summed the frequencies they reported across those 11 settings to create a score ranging 0 to 33, which we then categorized into 4 categories. Our main outcome was the household being hardship-free, meaning that the mother reported none of the following household level hardships: food insecurity, energy insecurity, which we defined as inability to afford utilities, housing instability, defined as homelessness, being behind on rent or multiple moves, and or healthcare hardships, which we defined as foregone healthcare for the child or another household member, or difficulty paying for household basic needs as a consequence of medical costs. And we used covariate-adjusted logistic regression. So to give you an idea of this sample of families, the majority, 84% of children had public insurance, and that's a function of our sampling in safety net healthcare settings. So this is primarily families living with low incomes. In terms of maternal race, ethnicity, mothers self-identified about half as Black non-Latina, a quarter as Latina, 19% as white non-Latina, and 5% reported being of other or multiple non-Latina races or ethnicities. 2/3 of mothers actually reported experiencing no racial discrimination in any setting. And then you can see here the distribution across the other categories. 12% of mothers reported being in this highest category with a score of 6 or more. And here we have results from the adjusted logistic regression. Higher maternal experiences of discrimination frequency was associated with far lower adjusted odds of being hardship-free. So for example, for mothers experiencing the highest level of discrimination, they had 69% lower odds of reporting a hardship-free household. We also looked at each of the 4 household hardships separately, and we found consistent results that higher maternal EOD frequency was associated with higher odds of every single one of those hardships. So what this really drove home for us is the need for policy and health systems efforts to prevent and reduce experiences of discrimination, but also for the need for healthcare provider education on trauma and a cognizance of and sensitivity about the interplay of lived experience and basic needs access for providing trauma-informed patient care. Well, thank you. I know that was short and sweet. I'm going to barrel ahead because we have a packed session, but like I said, we will have time at the end for questions if you have questions or comments about this presentation, and you can see both my email address and the website for Children's HealthWatch down below. I'll stick them in the chat as well. So thank you, and I'm going to turn the virtual podium over to Kelley now.
Thanks so much, Félice. So I am going to share with you some of our experience using community engaged research methods within a place-based intervention in West Philly. And I, like Félice, am going to probably go through these slides pretty quickly to get to the meat of the conversation, which my colleagues will lead toward the end of the session. So the West Philly Promise neighborhood is a 2 square mile area in West Philly that is where we have a place-based initiative that's funded through the U.S. Department of Education, initially as a 5-year grant, now extended to 6.5 years, to improve education, health, and economic success for children, their families, and their communities. And the evaluative components of the grant require data collection and integration at multiple levels, including individual, school, and neighborhood. And for the purposes of this presentation, we're going to be focusing on the neighborhood data collection. So a little background and context about the neighborhood that we work in, the West Philly Promise neighborhood. Demographically, the population in the neighborhood is primarily African American. Historically, it's been a primarily Black community. And due to historical disinvestment in the community, a high percentage of the households in our neighborhood experience poverty. the premise neighborhood is managed by Drexel University, and historically the university has had a complicated relationship with the surrounding community. So historical tensions include a history of widespread community displacement in the name of development by Drexel and other surrounding institutions, leading to lack of trust in university intentions. Residents also feeling like because they're living adjacent to two large universities, like they're heavily researched and they don't often see the benefit of the research and how it benefits their communities. Other current day tensions within the community include pressures of development and gentrification and concerns about continued displacement, tensions between residents living, long-term residents living next to students who may be a more transient population, and significant concerns at the beginning of our grant about whether Drexel would be good stewards of this $30 million grant, and particularly around our high budget for research and evaluation. So understanding this context within the neighborhood and the history of the relationship with the university and in the neighborhood, we approached our work with these guiding principles. First, we acknowledge and honor the experiences and concerns of the communities that we're working within, and that includes past harms and current pressures. And there's no limit to the number of times that we have these conversations. We've been working within the community for 5 years, and these are still very active concerns. We provide community partners with substantive, frequent, and meaningful opportunities for input, and we incorporate that input. We also compensate partners and community members for their role in the project. We establish and honor a transparent accountability structure. So we don't conduct any research or release products that are not reviewed and approved by our community partners. And we strongly believe that the data that we collect belongs to the community, and that we have an obligation to make it accessible to the community in multiple formats that are useful for planning and advocacy. So our neighborhood survey, which was grant required, required 3 waves throughout the 5 years, the initial 5 years of the grant. So we did 3 waves in 2018, 19, 2021 with households with children from ages 18 and under. And we covered a very broad range of topics that were of concern, not only to the grant and the project, but also to our partners in the community. And over the course of the grant, we hired and trained 20 community residents and survey research, and they worked as surveyors throughout the 5 years. We had a pretty comprehensive advisory structure, and still do, that's comprised of community leaders from civic councils from each of our neighborhoods, CDCs, faith leaders, other city, school district, and nonprofit partners. And we utilize participatory processes throughout the planning, administration, and dissemination of the research, including partner input and surveyor input in developing the survey tool, developing outreach plans, recruitment materials. We utilize our partnerships within the community to recruit surveyors who live locally. And we also have over time worked very closely with our partners and our surveyors to develop reports and products that are useful to them and their communities. And here's just a quick slide showing some of these co-created dissemination products that we've developed with our partners that are available on our website. So now I'm going to hand this over to my colleague, Rich Dollery, who will lead a much more in-depth discussion about our processes. and how they've impacted our work over the life of the grant.
Thanks, Kelly. Good afternoon, everyone. So for this next portion of the presentation, I'll be moderating a panel discussion with three of my colleagues, all of whom are long-term residents of the West Philly Promise neighborhood. And they've had various roles, including being surveyors and as data leads. And I really want to underscore the point that they're really experts by experience on the topics that they'll be discussing. So could you all introduce yourselves?
Hi, my name is Hyden Terrell. I'm a community member for over 67 years in West Philadelphia. I've been working with Drexel from the onset of the West Philly Promise Neighborhood Survey in 2017, and I still currently work for them as a data lead.
Good afternoon. My name is Rita. I've also been a lifelong West Philadelphia resident of 65 years. I started as well with Hyden in 2017 and is also a data lead.
Hi, my name is Christina, and I have lived in the community for the past 15 years. I've been working for Drexel West Philly Promise neighborhood for the past 4 years, and I'm also a data lead now.
Thank you all. Okay, so now that you've been introduced to Rita and Christina and Hyden, they're going to be sharing their perspectives on the relationships between research institutions and the West Philadelphia community and how that's improved through their work with the Promise neighborhood. So our panel will cover a range of related topics, and it's going to last about 20 minutes. And then we'll have some time at the end that we'll save for follow-up questions. While we're having the discussion, please feel free to drop any questions in the chat. And we'll try to get to as many of those at the end as possible. But before we begin, just kind of as a quick warm up and get our wheels turning, I'd like to pose a question to the audience. So I'm going to drop the question in the chat, and then I'd like each of you to take a second to respond. So the question is, why is developing a community-based workforce necessary for social care research to advance racial equity? So we'll just give folks like about a minute or so to think about that and reply.
Can you repeat the question, please?
Sure. It's why is developing a community-based workforce necessary for social care research to advance racial equity?
If I may approach the question, I'm coming from our last session, and one of the discussants was asking a question to the researchers as to why most of the targeting audience was of the female race versus that of the male race, and specifically Black, Brown, and people of color and the men. And I think the biggest reason is a matter of trust. And men normally, in general, are the last to see the doctor. Women are more apt to, when there's an issue with their self or with their family, they go to see a doctor. And a lot of times it's advised, if there is a male in the home, the male will encourage the wife, the spouse, or et cetera, to go before he will go himself. So I think that's a good reason, and direct to your question, why community-based services are so much important, especially for the racial inequities.
Yeah, that's a really good point. I think we have three very amazing women on our team that are representing well in this area. So thanks for making that point. Just looking here at the chat, I think there's a lot around being able to have equitable representation, being able to build trust, and having understanding. And these are all really great points. I think we're going to touch on several of these throughout the panel. So as I mentioned, our primary focus is going to be around the importance of trust, communication, and transparency in that relationship between community residents and research institutions. So without further ado, let's start with our first question for the panel. And so as residents of a primarily African-American community that's been frequently researched, what is your impression of the community's level of trust towards local institutions involved in research?
No trust,
None at all.
none at all.
Mhm. And this is, and where do you think this distrust came from initially?
Well, I'll start with over 50 years ago, the university came through the neighborhoods. All they wanted to do was buy homes from the people. They shortchanged them, they took their property and left.
Unclear motives, like we don't know what the research is for, why y'all coming in our neighborhood, and y'all continue to not give us any answers.
And a lot of people felt that they were outsiders, and that's how they recognized them as outsiders, and they weren't they didn't feel relatable to the people coming into the neighborhood.
And then negative interaction with the community.
Were there some specific negative interactions, Rita? that you
Well,
want-
what they did was, okay, like I said, 50 years ago, they bought the property. 40 years ago, they changed our area name from West Philadelphia to University City. So they just made it worse.
So let me ask you this, from your perspective, has that community trust improved since you've been involved with the Promised Neighborhood?
Oh, most definitely.
Yes, most definitely, yes.
And why do you think that is? And so can you tell us how your work with the Promised Neighborhood has kind of contributed to bringing that change about?
Well, Drexel has put investment into the community now. They've made a space called the Dornsife Center, excuse me, Dornsife Center School of Public Health. And in that Dornsife Center, they have from school-age kids to elderly, where they have programs available. They have wellness centers, they have nutrition programs. They also have resources. They offer programs to the neighborhood, and they hired the people from the neighborhood to actually run the Dornsife Center.
Mhm.
They also went and bought a building called the West Philadelphia Community Center. They met with the community, broke it down in age groups, what are we looking for? And to keep a developer from buying it and building apartments in that area, in that spot.
And then the West Philly Promised Neighborhood programs that support families and children. They, for instance, one school that we worked with was Luck, and we helped them with their after-school program with healthy eating, bringing fresh veggies into the families there in that particular school.
In the West Philly Promised Neighborhood Survey, they hired community members, provided income and new professional skills for community members throughout of our community. And the community members see us in our orange shirts. We keep going back.
Mhm. That's a lot of great examples. I think you talked about the last thing you mentioned, Christina, is about the community being able to see you out there and be able to relate, and tying that into kind of communication. So what was the communication like in the community from your perspective, from research institutions before the Promised Neighborhood?
There wasn't any communication. There was no communication back then. Now there is communication. With the Promised Neighborhood, there is communication. We're asking questions and we're understanding where they're coming from with their answers. We're taking their answers back to the Promised Neighborhood, and we're changing the surveys and making a change for the community, making it work with the community.
Mhm.
When before we felt like researchers was against us and against our community.
So, and I think Kelley mentioned this as well earlier on, that the Promised Neighborhood is in an area where there's a lot of, there's two large institutions that do a lot of research. Can you talk about what the experience was like, maybe with some previous experiences when you were surveyed, or if someone came to do a survey?
When they came, they just came to knock on our door and asked, well, we're having a survey. I'm gonna make up anything about voting, and we want you to take this survey. And we're saying, so what's going to happen with these survey results when y'all find out nobody in our neighborhood is voting? And they said, oh, we'll be back, and never come back. So 10 years later, when it's time to vote again, and then they come back. They was just coming, taking our information and not doing anything.
So talk to us a little bit about some of the ways that the communication has changed with your involvement in the Promised Neighborhood since you've been involved.
Well, They have hired community people, and that made a big difference. They see us on a daily basis. They see us in the community. They know that we're sincere. They know we wouldn't be out there if it wasn't for a good purpose.
Absolutely. Regular presence at community events. We have still doing door-to-door outreach. We have continuous availability and engagement with the community. We just recently finished doing back to school nights. We did several community events over the past few months. And again, we still throughout the year participate in Parents' Day and almost any event that comes up within the community, if we're available.
So for those that might be wondering, can you just sort of wrap up, like give an overview or just speak to why that communication is so important, both from a community resident perspective and in your role as a surveyor and data lead?
Well, the fact that there was no trust, and then here we come, and now we develop a trust, we have a trust thing going on. They see us daily. You know, they stop and ask us. And the good thing about this survey through it all, each phase that we did, we came back with the data. So that shows that we were sincere with what we collected and as far as sharing with the community.
Yeah, transparency is something, again, Kelley touched on in her opening that I think is really important for us to emphasize and share, get your perspectives on as well. So what kind of transparency existed before the Promised Neighborhood? Just from your experience living in the community.
Community members weren't consulted.
Mhm. What specifically was sort of missing in that transparency? Are there some particular areas?
Well, it's important to be open about what you want and expect from the community in reference to your research and what you are going to do with it and why you are collecting that particular information. So community members were not exactly consulted. They felt a little left out on this particular area of transparency.
And when we came out, the first thing we did when we got answers at the door, we had a consent form that they had to sign. We left them a copy. The copy had names of the professors they could reach out to if they felt uncomfortable or wasn't sure what we were doing. That's all part of transparency. We left them a copy of the consent form.
So can you talk about some other ways that you've seen that transparency improve?
Yes.
The Promised Neighborhood?
Well, the surveyors could give the feedback on the questions being asked in the survey because we were looking at it from a community point of view. So we want you must bring, the language to the community on an understandable level that they can comprehend. So that's one thing. So you want them to be able to understand the questions, or you'll spend half your time explaining questions.
Right.
And then after each phase, we went to the schools, we went to community events. We took the data information, we left information in the schools. So again, there was that transparency. Anything you want to know from the results of the survey, we had it available for you.
So there was a concerted effort to sort of bring the information back to the community as opposed to just having it and not knowing sort of what happened afterwards. Is that right?
That's right.
Go ahead. More.
Creation of more opportunities for community members to take action based on the data that we work back to them.
So are there some things now that we're working on to help further
Helping.
transparency? Because
Yes, with the data we collected, now we helping them advocate for themselves once the Promised Neighborhood leaves. What's the data?
Well, we're also doing where civic, we have a lot of information that we feel several of the civil organizations within the area would be able to use, possibly if they were out looking for a grant, or if they wanted to just find out how much information on, say, for instance, education or housing might be available in the neighborhood. We could supply that data to them, and it's something that they could use. Our data stories also need to be at a level where people can understand and relate to them.
They can advocate for themselves.
Yes, advocate for yourself.
Yeah.
Great. Is there okay. Is there any other points you wanted to make or share before we move on to the next question? And I know there are several questions in the chat. We are keeping track of those, and some of them we're actually going to address in our next topic, and some of the other ones we're going to definitely save time at the end to respond to as well. All right, so we're going to move on to the next topic then. So now that we've looked at some of the benefits of having a community-based workforce, I'd like to get your perspectives on the kinds of things that an institution can do to actually build a successful community-based staff. And that's directly going to tie back to some of those, the questions in the chat. So like I did before, I'm going to drop the question in that we're going to try to tackle with this. And I'd like you all to respond with your thought. So this is for the audience. So the question is, what is one step an institution can take to build a strong community-based workforce? And we'll just give everyone a minute to think about that and reply.
I'm sorry. That's good.
Okay, just a couple more seconds and we'll wrap up. Some really great ideas being shared in the chat, and several that we're going to touch on as well. Relationships, finding out what the community needs, a lot about communication and relationship building, absolutely. Providing compensation, yeah. So, like I said, we'll be touching on these, and I think our focus is going to be around a couple of things in particular, which is hiring and training staff, as well as retention. So I know one of the first questions that was asked earlier on about how you all came to hear about these positions and were hired. So let's start with that. How did you all first hear about the positions at Drexel?
Well, I attended the Civic Association meeting and they had the link for the website, and that's how I found out about it.
I was currently involved with the CAC, and we were discussing the
Can you tell
survey.
folks what that is, Hyden?
Oh, God.
What?
Your-
Association, there's another two in there.
Geez, you been-
It's a community leadership group, right?
Yes, it is. I'm sorry. I just went up my head when you
That's
asked
okay.
me to say. I'll get back to you.
I found out about the job. I was at an outreach program doing a survey for another program for AFL that works with Drexel also.
Mhm.
And one of their coworkers that was working there seen me helping another person, and she told me about the job. And that's how I found out about the job, and I went and applied.
Yeah, and it's such an important point to be made about, and you guys all demonstrated this, is that you found out about the job through local networks, right? Whether it was civic associations or schools or other community events, and not really around like more traditional hiring platforms like, Indeed or something like that. Were any of you on a platform like that, like Indeed?
No, I wasn't. No.
Would you have ever heard about the positions if it was only posted on something like that?
Oh, I would, no,
No.
definitely not.
Probably not, because I don't, scan or search on those sites. No.
Right. So how you go about hiring is and recruiting for these positions is really important, and not doing it in just a traditional way. Okay. In terms of training, what type of training did you receive, and how did you feel that helped you, prepare you to be successful in the positions?
Had IRB training and CINI training. It prepared me to keep the confidentiality between me and our clients. And also we had survey practice, role playing, and one second.
Yes, well, they're utilizing a lot of technology that we were taught on tablets. We had field apps, we had Qualtrics, using Qualtrics and RedCap, different surveys, and the data collection entry. So we used survey practices of role playing, which was getting familiar with each question.
And then we were paired with similar personalities that we were ready to hit the street.
Mhm.
And we also got some good Zoom training also. So,
I think a lot of us got that Zoom training.
yeah.
Yeah.
So it sounds like the training that you received, it really helped prepare you in the areas of research, because that wasn't something that you had, spent time doing or had training on beforehand, right?
Yeah.
Right, yes, yes.
But you all did bring a tremendous amount of experience and expertise in other areas that probably contributed to your trainings, right? So how did your experience and expertise in the community help make the trainings that you were offered more effective?
It made it easier because we know how to approach the doors or approach circumstances within our neighborhood. We knew which streets to walk down or which ones not to walk down. Just because Google Maps said we should go this way, it might have been safer or a little more better to go the other way because we know the area. And that was a good one.
And then we were prepared for the homes, no judgment, and also how to handle difficult situations. If we were in a street, what our best move was to get away from that situation.
And we would provide ongoing feedback to the team on what was working and what was not working. It was a two-way street when you're out in the street. You have to keep communication going.
Absolutely. Absolutely. Okay. So I want to be mindful of time because I know there's a lot of great questions popping up in the chat that I want us to get to, but I did want to have you all talk a little bit about your perspectives on retention. And specifically, you all mentioned that you've been with Drexel for several years now in the Promise Neighborhood data team. What led to you staying on in the ways that you have for this amount of time?
Well, they made me feel comfortable. I could talk to them about anything. We were inclusive with events that were going on in the office. And we were able to go back and forth with lingo and technology.
Yeah, I felt respected. I felt like they was creating spaces and opportunity for me where I can be the experts and emphasizing the value of my experience. We had weekly staff meetings, able to give feedback openly and wholeheartedly, and they were able to accept that and grow with us.
And they appreciated us really, and they showed it by giving us special dinners and potlucks and bake-offs. I don't know too many people where their bosses and their supervisors cook for them. And we also had a good safety team. We were, alerts came out to us for any crime in the area. They notified police that we were in the area with our orange shirts, and they had a group chat while we were in the field. Plus, we would get notifications from, we have a app here called Citizen that alerts you if there's going to be any trouble in the area, and we just avert it and go to a different area. So that felt good.
Excellent, excellent. And so any other thoughts around why else you stayed? I know just from
The opportunity to grow and develop my professional skill. It helped me advance within the company. Like I advanced with the company. I grew with the company. It wasn't like just because you're a surveyor, your opinion doesn't matter and nothing mattered. You felt like everything mattered. It mattered. You mattered. As a community member, you mattered.
And the fact that we started from the beginning, we had to see it through. We wasn't gonna let it go.
We have to see
Absolutely.
it through, yeah.
Absolutely. From the beginning, when I started,
can't
I knew
lock
that I
out
was going to
those
stay the
communities.
5 years, and then we had the opportunity to continue on, and that made me stay even more.
I know it's been a pleasure to work with all of you, and Promise Neighborhood and the area as a whole has benefited a tremendous amount from all the work you all have done. So thank you for sharing your perspectives. And like I said, I did want to save a little time for us to talk about, had to have you talk about or respond to some of the questions that we had in the chat. So if we want to kind of look back here and see what questions we have that you all would like to ask.
Why
So-
did you choose to enter someone home without judgment? Is that
Yeah, do you want to take that one,
important?
Christina? Mhm.
I can. Why did you choose to enter someone's home without judgment? Is that important, and why? Because you have to go into most things in life without judgment. If you go in there with judgment, then you already judging them and who you think they are. You have to give the person a chance to get to know them. Let's hear what they have to say. Let's see how they have to feel. And that's what makes it important.
Mhm. And you can't always
Thank
judge a
you so
person on
much.
their environment, so you have to
Yeah.
consider that, that you just can't take it for face value.
Thank you so much. That's wonderful to hear that. Very wonderful to hear that.
Thank you.
A lot more people need to have that mindset. And that's why I wanted you to speak it out
Yeah.
so that others can hear it.
And the CAC is the Community Advisory Council.
I knew you were right.
Exactly, advisory. But
One of the other questions in the chat was, what were you all doing before this work? That was one of the things Hyden was doing, but I think it's maybe other work related things that you were doing or what you were interested in.
well, I was volunteering at my son's school and also doing customer service for a giant supermarket. That was it.
Okay, I was helping out with my seniors in the neighborhood because I'm a retired worker, so I was just chilling.
And I was retired and just involved in several civic organizations, and that's how I got involved.
Yeah, but I wanted to see change in my neighborhood. Like, I have a young son that goes to school in another Southern Promise neighborhood school, and I wanted to see change. So I had to see this come through. Like, it was different. It was different having community members, somebody that looked like me, come up to me and ask me for help. Or somebody that looked like me and being able to express how they feel and with no judgment. Just because there's questions on the survey, they still tell you how they feel. And you can go back and talk to your other coworkers about it and change can happen.
Absolutely. I see a question in here. I'm gonna try to get as many in as possible. It's asking, please ask the panel, are the Black and brown men responding to the program and at what %? So in terms of,
Yes.
Oh, God.
Yes, we have fathers in our community.
Mhm.
We have men in our community who speak up. Yes, they are responding. Is whatever home we go to, and if it's a man there, we get like 7 out of 10 of them. I love it.
Mhm.
Yes, men, they speak up. Men speak up. Men who want change speak up.
Mhm.
And we went to several homes and I was surprised if men had custody of their children. They were running the homes. There wasn't a woman there.
And men was conducting surveys with us also.
Right,
It's not an all-female team. It's men was there conducting surveys with us also. It was men there too. The fathers matter.
thank you. I'm looking back through the chat, but if there are other questions that the audience has, we've got another 4 or 5 minutes. We can take some more on the fly here, I think.
Let's see.
One of the questions, are we open to sharing our trading protocol?
Oh, yes. Oh,
I
yes.
don't know, Kelly, if you want to take that one. I think we
Yeah,
all
let
we can ask Kelly if we're allowed to. But
Are y'all gonna go back and help the community once y'all take our rights?
Well, we are, I don't know, Félice, we are really, what's that?
Go ahead.
We are in the process of really trying to kind of codify some of our training processes. And yeah, I saw someone in the chat asked if they've received qualitative training. They have all been trained in focus group facilitation and conducting semi-structured interviews. Hyden in particular has done a lot of qualitative coding. So we can keep you posted on the training protocol, but we're really trying to kind of codify the work that we've been doing over the last 5 years, that we've learned immensely from this amazing team.
Thank you, Kelly. There's another really good question in the chat. I want you guys to respond to if you can, and it is, what made you feel that you could trust the Drexel folks to the extent that you do? I think that's an excellent question. Oh, you guys are on mute. I know you have lots to say about that.
It wasn't more trust in Drexel. It was trust in our team. It was trust in Kelly. It was trust in Félice. It was trust that they wanted to see a difference. It was trust that we were going to go back and let them know what happened. We just had to trust ourselves.
And it was a trust. It was a trust that a bond between the surveyors and our staff team here. And we felt as if we could come back and tell them if something wasn't working, if something wasn't good, or if we needed more time, or if we felt as if it was a bad time to go out. But they helped to build the trust. I mean, the fact that they listen and they would act on what we would say, whether it was a positive or a discussion type of thing, it was always something that we felt like we could openly go to our team captains.
And when someone is concerned about your safety while you're out in the street, you have no other resource but to trust them. We worked together. They really respected our opinions. We met weekly. We had issues. We resolved them the next week. And that's where the trust built. We trusted each other. We knew we had to get it done. We wanted to get it done. We wanted to see it be successful. And it has been.
Here. Yeah. So I think we might have time for maybe one more question. We have one more question anyone wants to ask. We got a minute. I don't want to waste any time.
A quickie, and I just want to, because in case that last question takes us right to the end, thank you so much for the panel here and the participants and all of you who joined. Please, we're happy to follow up if you would like to contact us. And I see that Carolyn has been putting reminders in the chats to please fill out the evaluation. There's a link in the chat.
Yeah. So I guess we don't have time for the last question, maybe.
I guess that was the.
We'll share our contact information, and I know we'd be happy to follow up and talk to anyone who has more questions for us.
Thank you. It was wonderful to hear about that organization.
Yes.
Wonderful.
On behalf of the Siren team and our planning committee, thank you so much. That was a fabulous session. And now anybody